we have Dr. Kevin Kavanagh with us. Good morning, Dr. Kavanagh.
Good morning, sir.
I enjoyed your editorial in the Lexington Herald-Leader over the weekend.
Well, thank you, and I haven't been killed yet, so that's good. People, I think, have accepted it pretty well, that we need to do some changing in how we behave in order to get this epidemic under control.
Well, I saw last night on the news that if Florida were a country in and of itself, it would rank only second to the United States in number of cases, 15,000 in one day.
Yes, and that compares to the whole European Union, which has more people than the United States, having about 4,000 cases a day. They've crushed the curve. And I think the most important thing for me is we need to get these schools open. And we don't want to open them when we have a lot of community spread of the virus. When they talk about other countries opening them safely, they did it when the virus was crushed in their community and going down. Israel tried to open schools while the virus was spreading in the community, and they had to close about 100 of them, and they had outbreaks. Now, I don't know the details of that, whether it was the teachers or the children, but it wasn't good. Luckily, it does appear that the children do not get as sick and may not contract this virus as readily as adults, but a lot of this is just unknown. I mean, we've never done this before. So it's really sketchy research, and I think we need to side on the side of safety.
I'm assuming by all that you mean we shouldn't go back to school at this point.
Well, no, we need to go back to school safely. I mean, there's things I think that can be done, but when I say go back to school, I would leave it up to the parents to decide how exactly to do that. In other words, schools could have different tracks. Some people could go back to in-person schooling. Some people could do teleschooling, blend programs. You're going to have to get the schools beefed up as far as having hand sanitizer, good ventilation, because that's a key thing on indoors to prevent viral spread. Get the desks set up, try to get some social distancing. But of course, with kids, that's hard. First thing my granddaughter will do, and I'm sure of it when she comes into school, is to have a group hug. But the one really positive thing, and it kind of gets me because everybody talks like it's negative, they talk about decreasing class sizes. And to me, that's a good thing. We should have been decreasing class sizes a long time ago. It always seems like we've been cutting school budgets, and whenever we do that, we respond by getting the class sizes bigger and bigger and bigger, especially in some of our poorer areas of the nation. And I just think that that's one of the things that may be a good thing that comes out of this, is that there's more attention being placed on education, how to integrate online education a little bit better. And for example, using of iPads and computers was already being done, but I think this is going to accelerate it. And getting smaller class sizes, I think, is a plus. I think that's one of the pluses of this pandemic. Now, what you were discussing before, thin Oreos, that's definitely a minus. There's no reason to have a thin Oreo. That's in the same category as a Diet Hostess cupcake. And I mean, they have those. But if you're going to eat a cupcake, why get a diet cupcake? Either eat a cupcake or don't eat a cupcake, but it defeats the purpose of eating a cupcake. So that falls into the same category there. That's in the minus side of the pandemic, yes.
Now, Holly, you've got a public school student still at home. What do you think about sending the kids back?
You know, I don't know. And they sent out a survey to parents and asked us, you know, what we wanted to do. And I feel very torn. So I agree with Dr. Kavanagh. You know, he says that it's going to be hard to sort of trust kids to be able to handle going back in there. But I don't know how much longer mine, especially my youngest, the one that would be going back, I don't think he can stand it away from his friends much longer.
He's very social.
Very social,
yeah. Dr. Kavanagh, you have a quote from Dr. Hunter McGuire, president of the American Medical Association, from 1893. Now, how is that relevant?
Well, I mean, that's very relevant. Unfortunately, Jack, I don't have it in front of me this morning. You're going to have to read it.
I'll read it to you.
All right.
It says,
one of the most important questions of the hour. Now, remember, this is 1893. was quarantined. A study in dealing with infectious diseases in America was rooted dislike to the curtailment of the personal liberty of the citizen for the benefit of the people at large. All patriots representing every shade of political opinion should unite in demanding of Congress the passage of a law that will enable the government to properly protect its citizens against disease. There is such much reason why the power of federal government should be invoked to aid in repelling the advent of pestilence as to aid in the repelling of the advent of the hostile fleet or army. Now, that's 1893, so history does repeat itself, doesn't it?
Yes, nothing much has changed. And that's kind of what's unfortunate. We're still having this argument of social liberties versus the common good. Unfortunately, this is a much more deadlier and I would say concerning virus because it can leave long-term sequelae than what they were faced back in 1893. So I do think we need to get a national strategy. And I'll be honest with you, all this strife that we're hearing in the state and arguing among our leaders is not helpful. We need to come together to get everybody on board. But if we had a coherent national strategy, it would have negated the state infighting. I mean, that's the other thing. That's the lack of a national strategy and the mixed messaging that we're hearing. Because this virus just jumps from one area to another. So you can't wait till your house is on fire before you install fire alarms and fire extinguishers. And the narrative of, well, we'll wait till we see cases go up before we do anything. Well, by that time, because of the long incubation period with this virus, it's spreading throughout the community. And the virus will spread in Walmart of Louisville just as easy as in Walmart of Somerset. Not that Walmart is spreading viruses. I guess I shouldn't have stated a retail store because, they are definitely taking steps. But that is the reason why we need to be wearing masks.
All right, listen, I'm going to give you Wednesday off. How about that?
Sounds good. Well, we've got a big conference on Wednesday with a lot of European leaders. So if you don't trust the people from the United States, log on. It's a webinar. It's at healthconference.org. And you'll hear some leaders from the Netherlands, Spain, and Singapore talking about the problems they've had there and the strategies they've used to kind of combat this virus. So I think it would be very good for people who are in doubt of what to do to see what other people are doing outside the United States. Because believe me, this is not a Republican-Democrat issue. It is an issue of science and this virus against mankind, and we need to join together to snuff out the epidemic. Good news is masks, hand hygiene, and social distancing will do it.
All right, and you can report back to us on Friday. Thank you very much, Dr. Kevin Kavanagh.